There is depression on right side of cheek, and there is post-burn scar. This is inverted Y-shaped scar, and that scar is further creating depression, making depression more visible. So we are planning for scar subcision, fat grafting under the scar, and also the adjacent area. In any case of fat grafting, the most important thing is technique of harvesting fat graft. We are doing fat graft in almost every part of body, in face, under eyes, penile area, and male and female genital area. And my grafted fat is still there for last 15 years. So it's a very good survival of fat graft. In most of the cases, we need only one stage. In some cases, 2 stage or 3 stage may be required depending upon the volume of fat graft required. Up to certain extent, fat graft survives well. After that, you keep injecting, and that extra amount of fat will necrose. It will die because it will not get enough blood supply to survive. And that's why we need to do fat grafting in stages in some cases where very high volume of fat graft is required. In cheek, under eye area, nasolabial fold, lip, male and female genital, in all these areas, one stage was sufficient. The fat survived well. Nose, dorsum, and chin. This is the area which needs repeated fat graft. Once, twice, thrice. And it's because of bone over there, which is hard and compresses the fat. In chin, the skin expansion is very poor. In nose and in chin, the skin is tightly adherent to underlying bone. So limited amount of fat can be injected in one sitting, and that's why it needs 2 or maybe 3 stages. But the survival, final survival, is very nice. In chin, augmentation with fat graft is the simplest way of chin augmentation. We don't need to cut the bone, so the complexity of the surgery and complication thereafter is minimum or negligible. So this is the best way of chin augmentation, even if it needs more than 1 or 2 stages. Size of fat particle for different part of body is also important. Similar fat grafts can't be used everywhere in body. We use separate size for cheek, for under eyes, for lip, for nose, chin, and genital area. They are the commonest areas where we are doing fat grafting, and in every area you will have to choose size of the fat particle separately for individual area. This is multiplanar fat injection. ठीक है, थोड़ा सा अप करना, ऊपर की तरफ, ऊपर की तरफ, ऊपर। सामने आओ, सीधे कैमरे पे देखो, चेहरा